This is Boomer Life on CL 650.
Welcome back to the program. It's a real pleasure to have Dr. Chris Coburn with us on this episode of Boomer Life in this early portion of the new year. Deep in the heart of resolution season, weight loss has been the subject of our discussion today. Dr. Coburn is a laparoscopic surgeon. He's the president and CEO of SmartShape, and you can find out more about that operation at smartshape.ca. And, of course, he's also with us here representing Falls Creek Healthcare Center in downtown Vancouver at 555 West 8th Avenue. We've talked about some of the surgical remedies for weight losses. We've talked about the lap band approach, the gastric sleeve, Dr. Coburn, and the balloon. But I wanted to ask you, is it reasonable once you've done and we talked about there is a protocol that a patient needs to be assessed and approved to go forward with this surgery. Do you encounter, though, patients who come in, expect to have the procedure, and then just carry on as though they had prior to coming in to visit you, and expecting magical weight loss with no other alterations in their lifestyle?
No, absolutely not. I mean, we make a point of, and we emphasize as often as we can at SmartShape, that the lap band, the sleeve, the balloon, they're all just tools.
Yeah.
They're tools that allow people to feel satisfied with a smaller portion of well-chosen food. But to make them effective, you do have to make some changes. And the changes are not really in what you eat, but very much in how you eat. So we have to slow down. We have to chew food well so that it goes through sort of the narrow opening of where the band is.
Oh, right, of course, yeah.
Right? So it's like a funnel effect, okay? And eating slowly, because we want each bite to either go through the band, around the balloon, or down the sleeve before you swallow again. So that's not easy. That's not the way we typically eat. We typically now eat much too quickly, much too large a portion,
right,
and don't chew. So this is an education, and critical to the success with this is having the procedures, but also following up with a dedicated team like we have at SmartShape that are committed to patient success. We want people to do well, but we have to choose them appropriately ahead of time.
So if I'm down at Falls Creek Healthcare Center and I go through one of these procedures, and of course I've been assessed, I've been evaluated, I've probably spoken with a psychiatrist of some kind, and after it's all done, and I'm in the follow-up part of the program, and I'm still having kind of weird psychological issues. It's still not me yet, and I'm uncomfortable with the way things are evolving. Can I go back and see the in-house psychiatrist that evaluated me in the first place? Is that all part of the package?
Yeah, I mean, it's just as a correction, minor correction, it's not a psychiatrist. We do work with a psychologist.
Okay, all right.
At Falls Creek. And so if our team identifies...
Hey, folks, I just learned laparoscopic, okay? Sorry, Dr. Coburn.
So if our team in the follow-up with our patient identifies issues that need the expertise of any other professional, be it a psychologist, an exercise therapist, we have dietitians on staff, of course, because that's an integral part of what we do.
Sure.
But if they need other help, then we do our best to facilitate that support. We're not psychologists and psychiatrists, and we don't provide that ourselves, but we recognize that need in some, not all.
Of course.
You know, the overwhelming majority of people who are, for example, depressed, and a lot of people are depressed when they come to see us. Studies have shown us that the most effective treatment for depression in somebody who's overweight is to lose weight. And that once they do that, then a lot of the issues they have around depression seem to resolve.
Talk to us about sabotaging yourself. Because you're going to go out there and you're going to have one of these lap band procedures or a gastric sleeve, or maybe they're going to blow up that little balloon for 6 months, and you're committed to this. You're going to spend a few dollars, and you're going to really try to adjust your life. And yet you can't seem to shake the old eating habits. And then there's that lifelong favorite since you've been a little kid, ice cream. Ice cream can kill you, can't it?
Well, ice cream, of course, is a high-calorie liquid, as is chocolate and fruit juice and alcohol and so on. So, again, for our patients, if they want to have a treat, they want to have a glass of wine with dinner or a treat, it's not a deprivation thing.
Right.
We want people to be able to eat normally, just less of it. But if individuals get into eating a lot of high-calorie liquids, then they're they're reducing the effectiveness, and if you want, sabotaging the procedure that they've put so much into.
Right. So even though you may not be eating massive quantities of food, you can still drink a chocolate milkshake, and that's like a super portion at a fast food place.
Ice caps, right? That's our favorite. Somebody who comes in and says they don't know why they're not losing weight because they're not eating, but when we actually sit down and we work with them and we do a detailed dieting history, we find they're having 3 extra large ice caps a day. Well, there's 3,000 calories, but they don't think of that as food. So again, I get back to the importance of the follow-up. We have people who know these things. Our staff listen to people and listen for these cues and try to find out exactly why they're not losing weight. There's usually a reason. If you have one of these procedures and you do it properly and you follow them up properly, the success rate is very, very high.
Let's flip the coin and talk for a second, if you will, about what typically happens at lunchtime in Canada. I got 25 minutes. I got to be back at the office or back at the workplace. So all I'm going to do is blast down the street to the fast food joint. I'm going to grab a burger, fries, and a shake. I'm going to eat that thing as either I drive back in my car or as I walk back on the street. I'm not even going to sit down because I got to be back at my desk in 20 minutes. So I'm just going to power that food down, and by the time I'm back, it's all gone. I've eaten every shred of it. What kind of damage have I done to myself?
Well, this is exactly the reason we have the problem we have in North America with obesity and being overweight, is because we're consuming large amounts of calorie-dense foods, especially carbohydrates. We're not taking the time to chew things and eat slowly, and so we end up eating way more than we should. It's portions. It's always portions. And so yes, those things have to change. You can't keep doing that and expect to lose weight. So we need to make changes. You need to slow down. We tell people it's going to take you 20 minutes to eat a meal. Each bite goes in your mouth, takes 20 chews, right? And it takes 20 minutes to eat a small plate of food.
See, I'm always the last person finished at any table I ever sit at, and I take flack from people. Come on, Sterling, for crying out loud. We want dessert now, and you're still eating your main course. Tough. I'm taking my time.
Hence, you don't have the weight problem that probably a lot of the other people around the table do, because they've gone up and got seconds,
right,
or thirds, while you're still eating your first portion.
Still working on round one.
Yeah. So it's making those changes and being committed and working with a team and getting the kind of help and support, and surgery. Surgery works. It's safe. It's effective. And it's the only way to lose a significant amount of weight and keep it off. It's not about losing weight. It's about keeping the weight off. That's the magic ticket.
That's right. Dr. Coburn, we're fresh out of time, sir, and I'm a little disappointed because this could go on easily for another hour. You're a great guest.
I got lots of stuff in here.
You sure do. And you're a very energetic, positive person, and this has been incredibly informative. Just wonderful of you to stop by.
Thank you very much. It's been my pleasure.
Dr. Chris Coburn, he's the president and CEO of SmartShape, and you can check out his company at smartshape.ca, or better still, just go to falsecreekhealthcare.com. You'll learn about all of the professionals, including people like Dr. Coburn, and you can link to SmartShape through falsecreekhealthcare.com. I'm Sterling Fox. Thanks for being with us on Boomer Life. See you next time.